Thoughts aren't fact. Thoughts aren't intention. It's just a thought. So when you kind of think of a thought in that way, it gives us a bit more control of, what do we actually want to replace that thought with.
When we bring a baby into a family, we go from kind of being the main character in our own lives, like the center of our own worlds, to then suddenly, there's us, and then there is this little person that we then have to actually sacrifice quite a lot of ourselves.
Ngala acknowledges Aboriginal and Torres Strait Islander people as the traditional custodians of Australia and recognises their continuing connection to land, waters and community.
So we've got Divyah here today to discuss adjusting to parenthood, mental health and looking after yourself. Now, we just want to say that there may be some topics discussed today that are a little bit distressing in nature, so please take care when you're listening. So Divyah, can you tell us who you are and what programs you're involved in at Ngala?
Thanks for having me. So firstly, I'm a mum. I've got 2 kids in primary school. And at Ngala, I'm a counselling and clinical psychologist.
Divyah, during those early days and weeks, there is a lot of focus that is put onto baby. However, we know there is never just a baby. There is always someone else involved, usually mum. Can you talk us through some of your thoughts around this?
Yeah, so there's a baby and someone. It's such a powerful phrase, isn't it, in terms of, baby doesn't exist in isolation. There's always a baby and their caregiver. It could be mom, it could be dad, it could be anyone that's looking after baby. So baby exists in a relationship. So that phrase, there is a baby and someone, encourages us to look at the baby and also then extend our gaze to the person, the adult holding that baby. And, to almost validate the caregiver's experience, the parent's experience, that behind every nappy change, every feeding session, every time that the baby has cried or, had difficulties falling asleep, there's an adult at the end of that who's tired, maybe grumpy, really vulnerable, and is in need of a lot of care and nurturance.
Yeah.
So that phrase brings to mind the attachment perspective in that the baby's emotional development is very much dependent on the emotional availability of their caregiver. And so to support their caregiver is supporting baby. So we can't do it in isolation. Our system, our structures are set up where there is a focus on the baby. So when they go for developmental checks, it's like, how's baby doing? Let's, see how they're growing. And often, I guess, checks on mums or dads are often at the end, like a quick sort of afterthought sometimes. It's not the main focus and it's not a shared focus. And I think it's really important for us to remember this phrase that there is a baby and someone and babies don't exist on their own. Yeah.
You're so right.
Yeah.
And it's such an adjustment period as well in those, when we bring a baby into a family, we go from kind of being the main character in our own lives, like the center of our own worlds, to then suddenly, there's us, and then there is this little person that we then have to actually sacrifice quite a lot of ourselves for in order to keep them alive, because, we know that we've discussed it, we're the only mammals that, relatively premature when we're born. We can't walk, we can't talk. We need a lot of support from our caregivers to survive in that first period of infancy. And I always find that interesting when thinking about what do we mean when we say adjustment to parenthood, that there's so many layers to that.
Yeah, absolutely. So there are lots of worries, I guess, that, or concerns that, families have in that adjustment to period. So right from the, pregnancy period all the way to the, early postpartum months, there are lots of different concerns that come up. So for example, it might be baby related. Like, is my baby feeding enough? Is my baby sleeping well? Are there any health concerns? There might be worries around a rash or a fever and really sort of catastrophic worries sometimes. There might be concerns about the birthing partner, the birthing parent, where, they're healing themselves in that postpartum period. There might be lots of pain and, discomfort. There's fatigue as well. So, am I going okay as well in terms of the birthing parent? There might be practical sort of, concerns like, how are we going financially? How are we managing the household? Like, how am I going to get everything done on time? And, this sense of constantly needing to be on top of things, and then feeling like a failure when they're not like all met, those needs. There can be sort of psychological factors or emotional factors like, am I good enough? Have I got this right? Other people seem to get it and, it seems to be easier for them. Like, I feel like I'm struggling. I feel like I'm drowning. I don't know anything about parenting. So some of those emotions can come up like, ranging from anxiety to depression. It could be numbness. It could be this guilt that comes from, I have to be happy all the time because I've got this beautiful baby here. What if I got to be upset
I need
about?
to be grateful.
I need to be grateful, right?
But two things can be true at the same time. And
absolutely.
You can be very grateful for your baby, but also be really grieving for the person that you were before that baby came.
Yeah,
and
absolutely.
I think we forget that parents and mothers, they're not born and they don't know that. They're born as a mother on the day that they become a mother.
Yeah.
And then they have to learn everything alongside their baby.
Yeah.
And I don't think enough grace is given to parents to learn, to make mistakes, to ask questions and to not have it all together.
Yeah.
So it's really interesting.
Yeah, and that's a really common thing that people that we work with at Ngala kind of talk about, this identity sort of shift that happens, and sometimes they get caught up in this crisis, this identity crisis, like who am I? I've lost the freedom. I can't just drop everything and do the things that I want to anymore. I've got to think of this baby. Remember, there's no such thing as a baby. There's a baby and someone. And so it's lots of things coming up for parents. And it's really overwhelming.
Yeah.
And I suppose, it's very clear it's can often be a very high stress time. And when stress increases, we know regardless of whatever stage of life you're in or whatever situation you're in, when stress increases, there is then more risk to our mental health.
Yeah.
Those sort of things go a little bit hand in hand.
So that does bring us on to our next discussion point, which are what are some of the common worries that you hear from parents that they might feel after baby's born?
Yeah. So it could be anything from, I guess, like their own emotions. It could be sort of relationship sort of issues. It could be a sense of isolation. So feeling really isolated from their social sort of network. Maybe they've become out of sync, with friends who don't have kids or have kids that are much older. Sometimes it could be internal sort of difficulties, like, thoughts that are really intrusive or scary. And so it could be a range of different things that, people kind of talk about that they struggle with. Yeah.
It's interesting to bring up intrusive thoughts. Can you talk more about what an intrusive thought is?
Yeah. So intrusive thoughts are any thought or image that's unwanted. It's not something that you want to be thinking about, and it goes against what you believe and what you value. So there's this sense of that's just not me.
Yeah.
So an example would be an intrusive thought around harm to baby, like walking down the steps and imagining that I'm going to drop my baby, right? So that's an intrusive thought. And, when you have it, it brings up a lot of distress because you're thinking about harm coming to your baby. So that's an example of intrusive thoughts. It can be quite repetitive and it may come out of nowhere. So you might be sitting on the sofa and just kind of, trying to relax, and suddenly you get a thought like, oh, what if baby in the other room stops breathing? I need to go and have a look. And so, some of these examples do come up a lot in the work that we do.
Are there common themes that tend to come up? You mentioned like harm to baby, but any other common themes that come up when people do have intrusive thoughts?
Yeah, so it could be anything. It could be, anything and everything really. But often in the postpartum period, it's around baby. It's around sort of harm coming to baby. It could be sort of images. It could be scenarios playing out. It could be things that they've read and then thinking that it's going to happen to them, and then they can't sort of help that. It's really unwanted. It's uncontrollable. And they know that this is not what they want. They have a significant amount of distress when they have those thoughts.
And how common are they?
So it's really common. A lot of parents talk about having these unwanted intrusive thoughts. So some of the studies have shown that over 90% of new parents can have them. So it can be mom, it can be dad, it can be any sort of caregiver that's looking after baby. It can happen at any time during parenthood, but often there is a big surge of intrusive thoughts in that postpartum period, in the early months. Yeah.
And in terms of an intrusive thought, how might that differ from other mental health concerns that a mum might face?
So maybe let's talk a little bit about why they happen. So let's talk about why intrusive thoughts happen. So in that early sort of postpartum period, the parents are going through lots of transitions. There's sleep deprivation, there's hormonal changes, there is, lots of sort of responsibilities that now they're kind of weighing. And so they're really vulnerable to having these intrusive thoughts. So one way to look at it is the brain is wired to become really hyper alert and hypersensitive in those early months to protect baby. So it's just something that happens to parents. It keeps baby safe, right? So if you imagine that there is this bodyguard in your brain, and this bodyguard is scanning your environment and, looking for danger and then alerting you to that danger. And sometimes that danger is exaggerated. They kind of flesh out these sort of what-if scenarios. And, it gets you to start thinking about them. And then you become alert. And then you'd be thinking about how can I keep baby safe? So really, it's around protection. So it comes from a really protective place. So intrusive thoughts in itself is unwanted, distressing thoughts. So remember that bodyguard analogy? So if we think about that bodyguard showing you all these sort of scenarios, they're like pop-ups that kind of come up on your phone. Intrusive thoughts, as it happens, can cause you some mild to moderate sort of annoyance. Like you see it, it comes up, and then you press that X, and then it goes away, right? So it's very different to OCD or obsessive compulsive disorder. So OCD is when you have the intrusive thoughts, but then you feel like you have to do something to get rid of that anxiety that comes with the thought. So for example, baby's asleep, and then you have this image of, baby's going to stop sleeping. And then you go in and check. And then you come out and you're like, but what if something happened in the time that I walked out? I need to go back and check. And so that constant checking, that ritual to get rid of the anxiety of maybe baby has stopped breathing is kind of how OCD plays out. So the pop-up comes up, and then you click on it and you have to do something about it, right? So that's how it plays out with OCD. With postpartum psychosis, it's much more rare in the population. So when a pop-up comes up, the parent believes that it's real, like someone planted this here. They need me to act on it. It's real. I've got to do something about it. There might be hallucinations, like they're seeing things or hearing things that aren't there. There might be delusions, so like false beliefs, like my baby is evil. I need to do something about it. And so in that sense, there is not a lot of awareness that the thought, the intrusive thought, is not real or irrational, right? And so that becomes a medical emergency because then the actions of the parent can become quite harmful to baby and themselves. And so that's when, I guess, if you do kind of see, your partner or family member acting in a way that just doesn't seem like themselves, it's probably good to get them into hospital right away. Yeah. So I guess that's the difference. Does that sort of, I guess, help to illustrate?
It's really good to kind of differentiate and kind of understand like those, different kind of
the subtle differences,
the different diagnoses.
So I guess the main difference is the level of insight one has into those thoughts. So with intrusive thoughts and with OCD, there's a level of insight that, hey, this is not, what I want. This is irrational. It's uncontrollable to have them. It happens. We get all the pop-ups, right? But, what we do with them, I guess, it's the difference. Where with intrusive thoughts, we're in a more controlled ability to let them pass. With OCD, we feel like we need to engage in some sort of ritual. And with psychosis, we just have no control of that. We have no insight into what that thought is and how, it's different from reality.
And you mentioned that postpartum psychosis is relatively rare.
Yeah.
But OCD, is that more common?
Yeah.
Would you typically have OCD before becoming pregnant, or can it pop up in the postpartum period, if you haven't had a history of it?
Well, there are lots of, I guess, factors that can predispose you to developing OCD either before or after baby. So it could be, childhood factors. It could be family of origin. It could be genetics in terms of whether there are other family members in the family who have had a history of a mental health condition. So there are lots of different factors that can predispose you to, I guess, having OCD. However, it is lots of different combinations of factors and accumulation of stress and thoughts that go unchecked where then it can kind of, I guess, escalate into maybe that OCD sort of presentation.
I think it's really interesting to talk about it because I feel like it's more common to talk about anxiety and depression, probably because those things are the most common. But hearing about obsessive compulsive disorder in the postpartum period is really interesting. Also to know that some of those intrusive thoughts on their own, you know, are very typical, really common, as you said, over 90%. But then if it's leading to a drive to kind of compulsively do a ritual and that's having quite an impact on your day-to-day life, then that's probably that next step to go, maybe should go check in with my GP. Would that be what the first step would be?
Yeah, I think the first step is to be able to acknowledge it to your loved ones that, you know, this is kind of happening, because there's a lot of shame in having these thoughts. Like, you know, if you had the thought that I think I might harm my baby, you wouldn't want to tell anyone because there might be this fear of what are they going to think of me? They're going to think I'm, you know, not a good enough parent, that I'm a risk. And, you know, what if they take my baby away? What if they think that I'm not good enough to look after my baby? So there's a lot of shame and stigma around having these thoughts. So I think it's really important to kind of face those thoughts and to name it, and then to talk about it with people that you trust as a starting point. And then, you know, if those thoughts become really distressing and it's really affecting your functioning, and you're spending a lot of time thinking about those thoughts, then it's a really good idea to go to your GP or to your child health nurse and talk about, you know, this is kind of what's happening for me. And they can link you up with sort of more professional sort of supports, like a perinatal counseling service or a psychologist who can then, you know, do some structured interventions to help you through that.
I love that you've said how common intrusive thoughts are, because I do feel that a lot of mothers don't talk about it because of what you said, the stigma attached. I think it's really important that we let everyone know, actually, 90% of the population of new parents are going to feel this way and have these thoughts. If they did have an intrusive thought, what's something they can do in the moment to help?
Yeah. So I'd like to kind of maybe talk about two different types of, I guess, tools that you can have in your toolbox. So tools for the body and then tools for the mind. So I guess when we start to feel stressed, you know, our body goes into a different sort of, I guess, state, right? Like our, you know, heart rate goes up, we might feel really tense. So it's really important to focus on our body and how our body's feeling. So a really easy tool to use is breathing exercises. There are loads of breathing exercises that you can access on, you know, on the internet, and you know, and you know, guided sort of breathing exercises that are available through different apps that you can do. But a simple one is just taking a few deep breaths and just really calming that body down and returning it to some sort of baseline level. So take a few deep breaths. And then there are some grounding strategies that you can do as well. And one common one that's used really often in therapy is the 5, 4, 3, 2, 1 sort of method, which is looking around you and thinking 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and then 1 thing you can taste. So looking at your senses, like using your senses as a way of grounding you and bringing you back into present. Because an intrusive thought is a what if, like it's not really real, right? And so using your senses kind of gets you to think about what actually is real, because you've got evidence, what you can see, what you can touch, right? And also, I guess it can kind of, I guess, interrupt that sort of thought and bring you back to what you actually want to think about.
Yeah.
And then we've got some tools for, I guess, the mind. So one common tool is reality testing. So you name the thought and then you check, you know, how real is this, right? Thoughts aren't fact. Thoughts aren't intention. It's just a thought. So when you kind of think of a thought in that way, it gives us a bit more control of, you know, what do we actually want to replace that thought with, you know? So for example, if the thought of like, I'm going to harm my baby pops in, it's kind of like, whoa, I just had the thought that I was going to harm my baby. I'm actually a really loving parent. And, you know, thoughts aren't real. Thoughts aren't fact. Just because I have it doesn't mean I'm going to act on it. So when you kind of coach your mind through in that way, you can kind of, I guess, you know, reduce the power that thought has over you.
Yeah, and helpful to name it.
Helpful to name it. Absolutely. Yeah. And I guess going back to that pop-up analogy, letting it pass can be another tool. So, rather than clicking on it and, kind of engaging with it, it's kind of just click that X, don't get into it.
Yep.
These pop-ups are going to happen. It's just part of how we're wired, right? And, we've got this really overprotective bodyguard there to keep us and our baby safe. So it's kind of letting them do their job. And then we've got control of what pop-ups we want to actually pay attention to.
Yeah.
Yeah, I like those two approaches that we've kind of got because different people, things are going to work differently.
Absolutely.
So for some people, those more physical activities like the breathing and the kind of grounding, identifying things in their environment or either internal or external environment are going to be really helpful. And for other people, the more cognitive strategies, labeling, hey, I'm having this intrusive thought. It is an intrusive thought. It's not my intention.
Yes.
It's not something, there's no evidence. Yes. What evidence is there that I would do this or have done this or something like that? Let's really reality test through a cognitive approach. And I think different personalities might, like both for a combination. So they're two really, really interesting techniques.
Yeah. And so Divyah, those are some really good tools for intrusive thoughts and how to ground yourself in those moments. What are some things that parents can do in terms of self-care to make sure that they can stay at their most mentally well while they're in that first 3 months?
Yeah. I think it's really important to go back to that phrase of there's no such thing as a baby, there's a baby and someone. And we really need to look at what that someone does for the baby. So, there's an invisible sort of mental load that someone carries or, a few people carry. So, for example, the primary caregiver, let's say it's mum, and, shares the load when, dad comes back. And so dad does, a nappy change or feeds. But still, someone needs to carry the load of organizing appointments. So what's next after this feed? What time does baby go to sleep? All of those things. And so I guess it's kind of recognizing that it's not just specific actions. Caregiving is a relationship, right? It's a relationship with baby. And all relationships are important. And so I guess it's around acknowledging that invisible sort of load that's often overlooked, and to be able to kind of, I guess, even just have someone give you that validation around the things that you're doing. So as a parent or the primary caregiver, is to kind of, I guess, acknowledge that it's more than just a set of actions. I need to really look after the way I'm feeling and the way I'm doing, and then to kind of almost recruit a village to kind of support you. And I guess, lots of different family structures are very different, but it's finding the right fit, the right mix. So it's more than just, I guess, having an extended shower or a hot coffee. It's kind of the connections that really help you thrive in that, early months. And, having people to kind of encourage you, to support you, to validate you. And in the absence of that, it's to kind of look at, okay, what's missing here? How can we kind of, have those conversations to, bring to the forefront that self-care is about the emotional sort of, I guess, side of things as well, not just the practical side of things. So if you feel like you need some more validation or affirmation, it's about having a conversation with the people that are in your life, that are supporting you, that this is kind of what you need. So don't be afraid to say that it's nice to have a bit of a cheerleader every now and then. It's nice to, kind of, I guess, have appreciation for some of the things that are being done, like the behind the scenes work. Like the planning, the organizing, because a task, it's not just the end goal, but it's all the different steps that starts from that conception to execution that goes with it, isn't it? So I guess it's around being comfortable and confident to ask for some of those emotional needs from your loved ones.
It's a tricky thing because for me, that's so true. You need to be able to voice it for it to be picked up majority of the time by others around you. However, that's just another thing that gets added to the mental load of I now have to voice this. And so I think it's a really good conversation to have before baby's born sometimes if you 100%. Have the capacity.
Yeah.
And I really like that you've discriminated between, sometimes what we instantly think of with self-care, like, looking after yourself, maybe going and getting your hair done, or like, those, or more kind of like tangible things versus that actual more emotional self-care as well, what that could look like. And knowing that, dad might say, I'll put baby down for a nap, I'll sort out the toddler. you go out to your appointment or go out for a walk. Like that's just only one kind of side of it. The other flip side is all of the stuff that perhaps mum is organising, and we're thinking mum, dad here, traditional kind of family. Mum is kind of doing in order to get that little glimmer of, in inverted commas, self-care or time for herself.
Yeah.
That actually becomes the full picture if those people, that support network, whether it's a partner or whether it's other people, actually go, or actually for mum to actually get, bang for a buck out of this moment, let's emotionally support the self-care as well as practically with the, to-dos.
Yeah,
and that can be really tricky, as you said, because there's so much that that primary caregiver is holding in order to kind of, in those early days and years, in order to hold the household together. Yeah. But I really like discriminating around those two things. I think
a shower is not self-care. We know this.
Especially if to have that shower, you've
plan everything and then set the baby up and give them to someone.
Sleep.
It's just that's not self-care.
Yeah.
And I think self-care it's a funny term, because I think a lot of people do think of it as a selfish thing, or self-care, you're being selfish, you're doing this, but it's actually not. Self-care is, for me, when I hear the term, I think of someone who is doing something that makes them feel like themselves. So that might be, it's going to look different for everyone. It might be reading a book, and you were like an avid reader before you had a baby. So for them to be able to sit down and read a chapter of a book is going to make them feel a lot more like themselves. Yeah. And that can really help with that adjustment.
Yeah, absolutely.
But having someone who knows that will really help you be you is also really important.
Yeah, someone who's able to anticipate and to be able to, I guess, respond to your needs, right? Because remember, we talked about how baby's emotional development is really important on the caregiver's sort of emotional availability. And if the caregiver or the parent is so depleted emotionally, but then still kind of, struggling to kind of get everything done, like on a practical level, there was bound to be that resentment sort of, building in. So I think really looking at the practical and the emotional needs being balanced as part of self-care is so important in those early months.
Yeah.
Oh, I love this discussion. I'm going to go home and talk to my partner.
Yeah, and I think it gets renegotiated at every stage. Like, what looks like a self-care in the early months would look very different when it's a toddler and, when it's school-aged kids, right? So it's a conversation that needs to be updated regularly. So I think having regular check-ins with the people that are in your life is really important about what those emotional needs are. And sometimes you might not be even aware of what those are because there's no time. You've got to kind of be on a bit of a schedule, isn't it, when you're kind of looking after baby and managing household tasks. So I think self-care might also look like just taking a pause every now and then and just thinking, how is everything going? What do I want? What are my values? What would, make me happy?
Well, thank you so much, Divyah. This has been a really lovely conversation.
Yeah, thank you.
I really appreciate you coming in today and talking to us about mental health.
Yeah.
And hopefully we'll see you again soon.
Yeah, thanks for having me. It was really lovely being here.
Thanks so much.
Thanks for listening to Parenting with Ngala. The topics covered in our podcast are general in nature, and the information might not suit everyone. If you're in Western Australia and would like to chat about a specific challenge, you can talk directly to the Ngala Parenting line by calling 9368 9368. For all other links and resources, check out the Ngala website and the show notes below. Thank you again, and see you next time.